Behavioral and emotional disorders in children. Childhood mental and developmental disorders encompass neurodevelopmental, emotional, and behavioral disorders that have broad and serious adverse impacts on psychological and social well-being. Children with these disorders require significant additional support from families and educational systems. The disorders frequently persist into adulthood. These children are more likely to experience a compromised developmental trajectory, with increased need for medical and disability services, as well as increased risk of contact with law enforcement agencies. The discussion to the following 5 conditions: childhood anxiety disorders, attention deficit hyperactivity disorder, ADHD, conduct disorder, autism, and intellectual disability, intellectual developmental disorder. Anxiety disorders are characterized by excessive or inappropriate fear, with associated behavioral disturbances that impair functioning, APA 2013. Children with anxiety disorders have clinical symptoms, such as excessive anxiety, severe physiological anxiety symptoms, behavioral disturbances, such as avoidance of feared objects, and associated distress or impairment. ADHD is a neurodevelopmental disorder characterized by inattention and disorganization, with or without hyperactivity impulsivity, causing impairment of functioning, APA 2013. ADHD persists into adulthood in approximately 20% of individuals, Polizyk Road 2007. Autism is a neurodevelopmental disorder characterized by severe impairment in reciprocal social interactions and communication skills, as well as the presence of restricted and stereotypical behaviors. Intellectual disability is a generalized disorder that is characterized by significantly impaired cognitive functioning and deficits in 2 or more adaptive behaviors. These issues are exacerbated when investigating mental disorders in children, particularly in LMICs where other health concerns, such as infectious diseases, are priorities. Although regional differences may exist, the lack of data makes them difficult to ascertain. The 12-month global prevalence of childhood mental disorders in 2010. ADHD, conduct disorder, and autism were more prevalent in males. Females were more likely to suffer from anxiety disorders. Anxiety disorders and ADHD were more common in adolescents compared with children. Global point prevalence of childhood mental and developmental disorders by gender and total number of cases.